Okay. Hello and good evening. Agus Fáiltearóibh chuig webinar eile ón tucaí éireannach son mí chumas agus sláinte béile. Is mise cuimhín mac gcill fáideag agus is mise an tí a nocht agus tá mé broúil le chur in anadíomh Sharat Pani itá ag teacht ó Canada chun webinar ionach simúil a thuirtún na nocht. Everybody, you're very welcome to the Irish Society for Disability and Oral Health's webinar on teledentistry that's being presented by an expert, Sharat Pani from Canada tonight. Before I welcome our speaker, I would like to just advise people of a few points. We will have a chat function that's available to you during the talk. So if you have any questions that you want to put in, you can send them in using the chat. And we also have questions and answers as well. So if you have any specific questions that you'd like to put to Dr. Pani as well, you can get that done as well to our Q&A at the end of the screen. The presentation may be a little bit different for each of you depending on the device you have. So try and mess around with the view of it if you're finding these functions unavailable to you. We will also have some polls tonight, guys, to try and make this a little bit interactive. So I'm going to show you the first of a poll, and this is a little meet and greet. So let's try this one here and see if we can do this. So when we press a poll like this will come up and you will have about 30 or 40 seconds to answer it, in which case then we will then share the poll at the end and we will find out a bit about each other and about how things are going. So I'm going to ask people to please press the buttons there, and in about 20 seconds time we will share the information so that we get to know each other a little bit more. Okay, I'm going to give it about another 10 seconds, I'd say, so that people can finish these off. Okay, and we're going to end the polling there now, guys. And let me share the results. Now, so hopefully on your screen, you're seeing that we have a range of dentists and dental care professionals and a big group of other, which is quite interesting as well. So I'm really interested. I should have put in more options there to find out who you are. But a range of dentists and dental care professionals, which is great to see. Almost everybody from Ireland. Well, that's interesting as well, isn't it? I thought there'd be more from around the world. And I did put this one up here, which kind of ties in a bit what we're doing later as well, but just give us a bit of an idea. Okay, so we've got some beginners and one or two pros, and someone's not telling as well. Okay, so let me stop sharing those results. And thank you, guys. I'm going to encourage that you do interact with the polls as we go. That will be very useful for the conversation. So may I take this opportunity to welcome our guest, Dr. Sharat Pani, who is coming all the way from Canada and who is a researcher who has a lot of experience in publishing in pediatric and special care dentistry. And we are delighted to have you with us tonight. So thank you very much, Sharat. I'll hand over to you.
Well, thank you so much, Kev. I hope it's all okay and everyone can hear me from across the pond. And it's always a pleasure to be with the Irish Society for Disability and Oral Health. Interesting fact, you know, before I moved to Canada, I was in Saudi Arabia. We didn't have a society yet. So the Irish Society was my first society that I actually became a member of. So it's always good to come back home, though I've never been there. And it's really a great honor to be allowed to present this topic. So I know that Kev's going to put up a couple of polls later, so keep the chat coming. I've got like one eye on the chat panel here. But I'm just curious to see why people said they didn't use teledentistry, because by the time I'm done with this presentation, something's going to happen that you're going to say, maybe I am a teledentist, all right? But more importantly, I just want to tell you something. I am looking at this more as a researcher and less as a sort of expert in teledentistry. Now, why is that? Well, I guess Kev's going to allow me to share screen. And as I share screen, I'm just going to take you back a little and tell you a bit about my experiences with teledentistry. So before I moved to Canada, I spent a lot of time in Saudi Arabia. And one of the things that did come across my plate a lot in Saudi Arabia was the ease with which people there wanted to use WhatsApp. So, people would send their photo of a tooth on WhatsApp and say, what do you think is happening here? And about 4 years ago, I had a resident who wanted to actually do a thesis on teledentistry. And I'm going to have to request the moderator to allow me to share screen. I'm still not able to share screen. So the story goes that at that time, I said, look, don't be ridiculous. Nobody's actually going to do dentistry over the telephone. And this is true, because if you look at telemedicine, it's been around for at least 50 years. And ever since there were telephones, there was telemedicine. But teledentistry has obvious limitations. And one of the reasons why teledentistry has had limitations has been the obvious reason. You can't fill somebody's tooth on the phone. So my actual presentation, where is it says, to teledentistry to overcome barriers to oral health care. And if we are looking at this, I really want to thank a few people before I begin, because honestly, Dr. Mohammed Shah, he was my resident who came up and said, that he got me on this journey. And my dear friend and colleague, Dr. Zikra Khayal, who did a lot of work with me in using teledentistry to actually reach out and provide care to people with hematological disorders in Saudi Arabia. So Zikra, if you're around, out to you. And then, of course, to my dear friend, mentor, Alison Dougal, for supporting me and for actually putting this together. And to Professor Blanet Daly for actually getting me to present this earlier, an earlier version of this. So as you can see, this has been a bit of a journey. And for those of you who are not familiar with it, one of the key journals in telemedicine and teledentistry is the very not ingeniously titled Journal of Telemedicine and Telecare. And the reason I would like most of you to give it a read is because very often when you say you don't use teledentistry, you may actually be using teledentistry more than you think, right? So again, when you look at this webinar, what I want to be able to do is to define a scope for teledentistry, apply those concepts to patients with special healthcare needs, and more than apply it with my experience, explore it with your experiences. And frankly, keep the chat open on, and I really look forward to seeing if there are chat coming through. Simply because for me, I'd like to see how you see teledentistry. And most importantly, and because, this, when they asked me to do this webinar, I said, 6 months ago, this was a great webinar. But right now, everybody's a pro on Zoom. Everybody's attended these Zoom webinars. But where are the limitations? Where do we actually have a challenge over there? So for me, the last part of this webinar will be a bit about the challenges. And like I said, it's less of a preaching type seminar and more interactive webinar. So just keep those questions coming through. So if we were to look at the barriers we have to oral health care, and this is whether you're dealing with patients with special needs population or in general, the first one is, of course, ignorance. And ignorance, not just saying, oh, people don't understand the importance. Sometimes dentists ourselves, we don't understand the importance of, say, preventative care or the problems that patients may face coming to us. The lack of specialists, poverty, well, poverty is defined differently across the world, but it is a barrier. And you have the lack of financial resources. And when you look at financial resources, one of the ways to look at it is, are you looking at finance from patient's ability to pay for care? Are you looking at finance as the government's ability or willingness to invest in that care? And most importantly, can this teledentistry, telemedicine help us show that we can reduce costs? So for example, a euro saved is a euro earned, and if that euro that was saved could be reinvested into dental care, well, then you can, for the same budgets that governments are willing to put forward for special care dentistry, use teledentistry to multiply the number of patients served, the population served. So if you look at barriers of skill, of the medical understanding, of the feasibilities and the costs of course calling in a consultant, traditionally, we always want to look at it in terms of fundraising. And you say, all right, we'd like to raise funds for networks or for feeder organizations. However, teledentistry can overcome several of these barriers. For example, one skilled dentist can serve a much larger population when there is tele networks created. You can also provide training. You can provide dentist to dentist telemedicine, which is probably a lot safer than doing direct patient teledentistry. And we are going to explore where this entire network takes us, right? So if you want to look at why teledentistry, you can look at it from two different ways. You can say, one, that dentistry is a comprehensive specialty. We're the ones who refer patients, we require referrals. And of course, this is something depending on the audience. I'm sure the audience has general dentists, special care dentists, but we know this, that for the new dentist who's stepping in, one of the biggest barriers to special care dentistry is fear that, can I probably give effective care? So one, uh, we look at it as, can we apply telemedicine and teledentistry from one end? On the other end, we look at the technology available and the actual security of those technology platforms. What can we do versus what should we do, and what are the safeguards that we need to actually be talking about, that we need to be discussing? So if you are looking at questions, the first thing that we want to ask is it scientific? Is it reliable? Are there studies on the topic? Should we have definite protocols for each platforms? And what are the basic limitations of this platform? And what I'm going to try and do is present the existing literature, and I'm going to then open it up basically for everyone to share what they've been doing, because I can see quite a few people said they've been using it, they've started using it. And what can we look to achieve in the future? So if you look at digitalization, one of the things that people like to say is that, oh, digitalization is the sort of mantra that can basically solve all my problems. But if you look at digitalization, digitalization and telemedicine are not synonymous. That's right. Because the tele in telemedicine and teledentistry doesn't really stand for digital. It stands for from far away. And ever since the radio came up, there've been radio doctors around, there's been telemedicines, there've been health shows where they've actually looked to create, dial a doctor, dial in shows. If you look at the progress of telemedicine, the first photophone was actually in 1880. And by 1900s, you started having people exploring the idea that there could be telemedicine. And by 1924, you first had the first exposition on telehealth care. And by the time the internet has taken over, slowly we have moved into different realms of telemedicine. And this is really important, because if we look at teledentistry, and a lot of you answered that you had telemedicine experience. Most of us do teleconsultation. We say, all right, we will consult with you over the phone and then come in. And if not, you definitely, a patient's called into your practice and said, I have this, what should I be doing? And yes, the telephone has been used, right? So there's teleconsultation. Should we be doing telediagnosis? And again, now I know that with the pandemic, there have been a lot of people who've been moving in towards telediagnosis. Can we actually do teletreatment? And teletreatment, of course, I'm not going to say, okay, here, patient, hold this forceps and extract your tooth. No, that's not what we mean by teletreatment. But can we establish secure enough networks that you could have a supervising consultant supervising a fresh graduated GP somewhere in a remote area and actually deliver treatment? Tele-education were already there. I mean, look at us, we're having this from across the world. Tele-training, monitoring, and support. Now, this is something that I would like everyone, whether you're running a small practice with 5 individuals or a big hospital with 500 individuals, looking towards tele-technology to reduce your administrative costs, centralizing administration. This is a part of teledentistry that nobody wants to talk about. People want to talk about, yes, telemedicine, I can talk to my patients, and you're the care provider, yes. But as an administrator, there is also the cost of reducing expenses by centralizing and providing tele support. So, as I said, most of us focus on the first three: teleconsultation, diagnosis, and treatment. But there is a lot more to teledentistry than just that, right? So, if we were to look at a model of teledentistry, where we are right now is probably you have a dentist who's communicating with the patient. And I think we had a poll somewhere. I'm not sure if this is a good time to bring up the poll. I don't know if my moderator thinks it's a good time to bring up the poll. But usually the way you want to go with this is parent has a complaint or the caregiver has a complaint, sends a picture to the dentist. So I really want to know right now where you stand. Are you a yes person? Are you a no person? Look, this is not my cup of tea. This is not, I'm not happy with the guidelines, or I'm not happy with the safety of data out over there. Or are you on the place where it says, look, yes, but someone's got to have my back? I mean, if my service, my regulator had my back, I would practice teledentistry. And I will give you guys some time to just answer and let me know what you think. So please feel free to vote. And alrighty. So I can see this, there's a yes and there's a yes if there were clear guidelines. I don't see anyone with a no. And honestly, I'm going to actually speak to the people who say yes if there were clear guidelines as to what is it that we can do to help develop guidelines, right? Because as far as I can see it, teledentistry to me has always been the yellow box rather than the orange box. And the reason for that is that you shouldn't really be giving diagnosis on the phone if you can help it. I mean, personally, I find that, primum non nocere, do no harm. Try to look at teledentistry more towards getting a specialty or adding value, multiplying the force of practice versus actually getting consults which are, there's always a larger gray area when it comes to giving teleconsults. So the most important technology for teledentistry is a concept called store and forward teledentistry. Now, most clinicians here will be like, why do I need to know what the theory is? Let's look about the practice. And there's a reason for this, because store and forward is pretty much what all of us are doing if we are doing it. You're asking someone to take a picture, you're storing that picture, and you're forwarding that picture. So it could be a photograph, it could be radiographs, it could be digital radiographs, it could be a video, and you're forwarding that either to a practice far away, or what we're doing right now at my school, which is basically, where the students have intraoral cameras and they're taking pictures inside a closed room, and that's being beamed to instructors outside the closed room to cut down the number of times you have to change your PPE. The store and forward. So if you look at store and forward, there are just two important considerations. Where do you want to store it, and to whom do you want to forward it? And that is what 90% of your budget, if you were establishing teledentistry, would go into. A secure server and adequate net speed to forward it. So if you look at what can be done, well, if you look currently within the patient, you can actually look at a secure network where you could have patients send in lesions, you could provide non-essential consults and say, okay, you need to come in versus you don't need to come in. And this is particularly useful when somebody is really scared about what's happening. You've had a consult, patient goes home, patient, say for example, is bleeding excessively, or patient is a little groggy after you've done sedation. You want to actually get a better idea of what's happening with the patient. That would be telediagnosis. You could also have a teleconsultation where you call your patient in, if you are the general practitioner, and create a network, a secure network within your hospital to communicate those pictures. And honestly, when I first presented this about, it seems like forever, but it was just about a year and a half ago, most people thought this was like, oh my God, how are we going to do this? But today, I know so many of you already have secure hospital networks. I know my hospital has a secure network, and many of us are practicing this. So this was the paper that we did in 2018. And at that time, we were looking at basic validation of store and forward. And at what kind of validity can you get with a picture taken using either a mobile phone camera or an intraoral camera? And since then, we actually look at what kind of modifications can you make to that. Now, I'm not going to take you too much into the details, but what I want to tell you is basically what teledentistry does is it's a force multiplier. And what we can do is, and I can see my IADH president has a wonderful thing in the chat, and it's true. Once you have a hospital that has invested in it, that's it. I mean, right now, as Dr. Dougal says here, you have Blue Eye as a video, and the patient consultation program is Irish built and fulfills all regulations. I would basically say that's it. You have a wonderful, secure network ready, right? The next question is, to what level can you push this envelope, right? And this is where now, after I know, I am now a little scared, because here's the thing. When you're starting it up and when you're getting in, I would love to do a lot of things via teleconsultation. I wouldn't want somebody to drive, say, 200 kilometers to come in and see me. Certainly, I wouldn't want somebody to drive 200 kilometers, have sedation, and then have somebody drive them back. So if you have a secure network, what it does is it is a force multiplier. And here's the thing. What you should have is now you use these networks to then create a secure channel and a secure communication. And once this is in place, if one hospital has it, you should be bugging other hospital administrators to invest in it. And the best thing you can do, because one of the things that the pandemic did was it suddenly freed up purse strings for this kind of technology, exactly the kind of stuff that Allison's talking about in the chat, if you're looking there in the chat. But what you really want to be looking at now is, now that it's in place, obviously this stuff needs to be built on and expanded on. If I was here, and if we have any auditors in the participants, or if any of the participants more likely know an auditor, you'd be going to your hospital auditors and saying, you know what, this was what we saw. These were the numbers we reached out to before you put in the software. These are the numbers we have reached out to after you've installed our software. Do your cost benefit analysis. Do whatever quality assurance analysis your hospital wants you to do. And tell me that we're not seeing more people for the same number of hours, for the same number of people employed, and that we're not improving quality of care. And personally, I do believe that regardless of specialties, you should be looking towards it. And I saw somebody say many medical specialties really do, and I agree. But the point is, again, it's a question of one body endorsing it. And I can give you a really good example of actually psychiatry. So across the world, there have been psychiatry societies which have invested in telepsychiatry. And yet there are people especially in my own home country of India, who've been dead against it. And to be fair, all it takes is one person to endorse it. And again, this is, I'm glad Alison's here because I use this so many times. I know this is her work from over 10 years ago, but it remains really relevant. This is British statistics from 2008. But if you look at it, all we want to be doing is the special care dentistry, special care dentists across the world should be looking at this 0.2 million. Or in Canada, where we do not have special care dentistry as a specialty, I always emphasize, I say we want to see that hospital referral reduce. Because here, where hospital dentistry is covered by universal health care, we have 1 year waiting list to get people into operating rooms, and that can greatly be reduced by special care dentistry. And I believe that really primary healthcare services, when they are backed by the sheer confidence of having a specialist on call. And this is another point that really what teledentistry allows people to do. It's not something that comes out of the goodness of your heart that I will help a junior. No, this should be in people's rosters, in people's schedules. I have a teledentistry clinic from 2 to 4 or from 2 to 5 or from 1 to 5 in the evening, and during that time I'm available on call. You can book me in. I will be in your room. Now I know that there are a lot of these cams, the intraoral cams especially, which can give the consultant the same feeling of being in a room when they are, whether they are like 10 feet away or whether they're 100 kilometers away, it doesn't make a difference. But I really do believe that we can have them. So if we look at them, there are three basic problems or challenges for this. The technological limitations. Personally, for me, I believe that there is a technological learning curve. I wasn't so cautious 6 months ago when I gave this, but having practiced this now, having practiced this, within room teledentistry, I'm beginning to see the limitations. And one of the biggest limits. So for me, basically, my bread and butter is I teach undergraduate dental students. And I know that if you're dealing with an undergrad, the technology still isn't good enough for you to be able to say that, an undergrad has removed caries completely. But if you are using this with, say, a final year student or a resident or what we call a general practice resident here or GPR resident here, it's really more than well, it does more than enough to allow you to be able to monitor the patient. And I'm talking about intraoral cameras here. I'm talking about actual consultant supervision of an inexperienced practitioner. I believe we have technological ability to do that. The ethical part, look, right now, between the legal and the ethical, I'm always a little loath to comment. And especially this is being recorded, don't quote me on this. But I believe that ethically, it is ethical as long as you have invested in a security check for your software. So for example, here at Western, we have something called a technology risk assessment committee. And the committee actually reviews every software that you use for patient risk, for exactly the risk that we're talking about, that somebody can actually leak data. And I think that once these committees are established, I think it's a question of when is it established. So I think 2 years ago, there was an incident where a laptop was stolen and data was leaked. The result of that was they set up this committee. But once the committee was set up, pretty much every new software that you want to implement today can be implemented. And the last part, like we can see, the laws can be written. And oh, wow, I've got WhatsApp. And I see that WhatsApp is actually fulfilling. That's what I can see here. I can see the chat going on there. It's kind of interesting because WhatsApp isn't legal here. I'm not allowed to do it here. I'm not allowed to do it in Canada. I'm not allowed to actually send a photo or store a photo. At least my school doesn't allow me to do photo consults on WhatsApp. You can unofficially advise, but you cannot actually give a diagnosis for me. So I like the thing. if you don't record anything, can you use video call software? I'm seeing a little chat going on there, so I'm just going to let the chat go on. I'm going to let my moderator let it go on. But it's a really important part because I think it's something that you need to be aware of. Personally, I'm not a legal expert, so I don't want to comment on this. But one thing that my committee does here at Western is they actually evaluate software for exactly this. So whether you record or not, a lot of stuff goes into the cloud. So you may not hit record on your device, but there's stuff that you say that can be retrieved from the cloud. And I think what these committees do is they actually assess risk. So for me personally, like I say, I leave it up to every single committee to make that decision. But if you look at teledentistry, I just put at what was there. I put you guys right at the top because I think of all the places where there have been updates, I think Ireland has been remarkably progressive in the way that you've taken up to not just teledentistry but also telemedicine. I mean, your regulations have been a lot more common sense. It's been a lot more practical than many parts of the world. We do have, like I said, here in Canada, on this side of the pond, depending on where you're based, local committees still are very wary of teledentistry. We're just launching pilot programs. Actually, we're just wetting and starting out with pilot programs. Personally, what I would like to see teledentistry used for is actually tertiary prevention. I mean, is primary prevention or primordial prevention, where you're looking at establishing a dental home, establishing a weekly check-in or a monthly check-in or a 6-month check-in. I really would like to see that used more. But as I said, doing it for treatment has its pros and cons. But personally, I would also like to see teledentistry used a lot more for prevention. So if you are looking at the implementation, I really believe we need to build on these lessons that we're learning. I think that a lot of money and time has gone in. And as I said, I really respect the job that the Irish have done with telemedicine and teledentistry. I think you've been amazing when it comes to accepting it. So I really, really want to conclude by saying that this is an idea whose time has come. I believe this is an idea who really, I think it's something that should be embraced. And as I can see, there are quite a few pros on the side, putting in the Irish perspective. I hate to be the person coming in and trying to tell people what to do. So I'd just like to hand over back to Kev and the moderators. And really, Kev, if you'd like to open it up to some of the people who've been using teledentistry in Ireland, I'd really like to hear what they have to say. Because I know that people like Alison really embraced this early. They got in really early. Actually, that's why I really want to thank both Alison and Professor Daly, because they really embraced it way ahead when the pandemic just began. And I think, really kudos to the Irish Society and to the Irish special care community in general, because I think you guys embraced it way better than we did here. So thank you for the opportunity for speaking here. And I'm happy to participate in any discussion you'd like to go with.
Yeah, that's fantastic. Thank you so much. On behalf of the attendees and the society, I'd like to thank you very much for sharing that. Really nice, like a really nice presentation of the core of this. And I think hopefully what we'll have now is a conversation around this. And I welcome people who are on the webinar. If you'd like to join the panel, you're more than welcome. If that's okay with you, Dr. Pani.
Oh, perfect. No, I'd love that. I mean, I'd really love that. Thank you. Thank you.
We can have a chat. I suppose while people are coming online, just put your hand up and maybe I can get you guys onto the panel. No problem. If I can start the conversation, I suppose. And I wonder if you are seeing the best of Ireland through Prof Daly and Alison Dougal, because I wouldn't I feel like definitely they've been at the cutting edge as I've seen it as well. So I think I'm not sure if the rest of the potential that you've demonstrated today if we've really grasped that in Ireland.
Well, I'm not sure. I can't speak for that. And I know Alison's here, so I'll let Alison speak for herself. But I'll be honest with you. You know, what really impressed me wasn't the fact that you have people advocating this. No, that's not the thing. The thing is, you have one hospital that has one secure server that has shown proof of concept. And for me, that's all it takes. All it takes is one. You know, because now once that is done, Ireland can say that you have a secure server that has been approved and that is regulated. And you know, for me, that's the point I'm trying to actually get across here, that, you know, you may agree with it or you may disagree with it. You may say, oh yeah, you know, I'm not going to place it. But, you know, once you've made that initial step, once, you know, for me, we're going to experiment with this coming summer. So you know, when you look at best and worst, it's relative. You know, the point what that I'm really trying to make is the you know, a reaction's only as fast as its slowest step. A chain is only as strong as the weakest link. And I can throw another 100 platitudes. I'm sure that you have some Irish platitudes for the equivalent. But the point is just that you know, the weakest link is the secure server, because that's what takes money, that's what takes time, and that's what takes red tape to be cut through. You know, all the red tape that needs to be cut is usually with these evaluation committees. If you've got an established server, which I can see from the links, from what I can see on your chat, you already have an established server. That's like half the battle won. I mean, you've got everything ready. Now, whoever wants to join can join in, and whoever doesn't want to join can opt out. But if a patient wants teledentistry, it's there. And I think I saw somewhere in the chat that special care dentistry has adapted to teledentistry better than other specialties. And I'm like, that's fine. You know what? If there's a pediatric dentist in Ireland who says, I'm going to use this network, my network's already built. If I was a prosthodontist in Ireland who said, you know what, I wanted to use this network, my network's already built. And I think that's the thing that we really want to be looking for. You know, I mean, I think that's the thing that we really want to be, you know, fighting for. It only takes one. It only takes one. I mean, after that, you know, you can have 100 people come in and join, or you may have just another person come in and join. But somebody's already paid that bill for that secure server. Somebody's already paid the bill for that network that you've created. And for me, like I said, you know, it's beautiful to see that.
Yeah, I suppose I have a little bit of experience from what Alison's brought in for us in the dental hospital, and in my students have it and I have it, and we definitely are finding that it's easy to transfer information for patients from hospitals where before we couldn't figure it out. So we do have secure means of sharing. And when I look at the attendees tonight and I see people from across services in Ireland, I just see the potential for us adopting a universal system, a shared network where we can share this information seamlessly. And I think that's one of the great advantages that teledentistry brings. Like there's a great opportunity here, isn't there, Sharat, for many advantages for special care. And
well, I do, and I'll be honest with you, Kevin. Nick, again, you know, I know that we always treat you as sort of moderator on this, but I also know that you are one of the really, you know, the first special care dentists in Ireland, and I know that you really are a really sound clinician. And I really wanted to know one thing though, that, you know, like if you're looking at the barrier, personally, I don't know if it's the same in Ireland. I'm sure it is. I think the biggest barrier is fear. Because if you're looking at dental students, and I know Ireland has a far better structured undergraduate special care curriculum than we do here on this side of the pond. So I think one of the biggest advantages the teledentistry offers is, let's say you've just graduated and you're in wherever, in rural, whatever, trying to do something. You know, the ability to speak to someone and say, you know, it doesn't only have to be for special care dentists. It should be like, you know, I'm not happy. You may be a special care dentist and you say, you know what, I'm not happy with that finish line. Maybe I could just dial a prosthodontist and send this picture to him and say, you know what, do you think that finish line is okay? You know what I mean? And for me, that's what I really think is the future. So I think we just have a chat, and I think there are stuff that I should be kicking to you, Kev, or maybe we get our get Alison on board on that. But I think there's a very specific Ireland-specific question there, which I'm not qualified to answer. So
yeah, so can dental practices use a software program that the DDH has signed up to, or do they need to invest in their own package? Okay. Yeah, I think I'm not sure. I'm not sure how that works either. And it's Shane, I think that's one of the national questions of what are the first things that the practitioners on tonight who want to get into this, what are the things they need to do? And I know I suppose many of us here tonight work within either a hospital or a health service. And I think a lot of it is about getting buy-in from our directors and our bosses, so that they can understand that teledentistry is good dentistry, and teledentistry is a dentistry that is what were the words that enables people, our group of patients, that breaks down barriers that before could not be broken down. So it's kind of like domiciliary care is viewed as a second-class dentistry. And I wonder, do some dentists kind of see teledentistry as a second-class dentistry?
well, can I answer that from my experience of practitioners? Because, like for me, I'll be honest with you, I'm primarily an academic. I don't make money off my practice. My practice is regulated by clinics. So, but I just saw something there that really sums it up for me. It says the pricing could add up. And I think that's it. Once you've done that, I think that's the barrier to cross. And I'll tell you something. I mean, Alison's been a mentor to me as she's been to you. So she used to always say something when I first got, and I've always loved quoting her on this. She always say, you got to see it. It's not charity. What you're doing, it's not charity. So you can't see teledentistry as a charitable thing that you want to do only for the, you can't say, oh, I want to do teledentistry, but the government should sponsor it because we have a pandemic going. And I think if you go with that approach, you're destined to fail. But once you see teledentistry as something that can, create your own little secure network, and the pricing adds up, what eventually happens is you have your dental associations buying in. And I think personally, I'm probably being, really romantic and dreaming about this. But what I would like to see, and I'm actually happy. So step one, you see first the universities buy in, and then the government hospitals buy in. But really, where it really takes off is when the provincial dental associations or the societies buy in. Because when the society buys in, so let's say, like, for example, you have a dental association that you're a member of, and you have all these specialists that pay their membership dues. If the specialty association says, oh, you know what, we're going to buy this and we're going to provide all our members access to the network through each other. Then what the associations are doing is they're basically saying, all right, we get it. We get that the pricing is expensive for a single practice, but you could sign up to us and then we could have that, moving on. But again, these are just, like I said, ideas to be thrown out. I mean, just basically thrown around, bounced around. Some are good, some are bad. But I can see that there are packages. And again, I think people are looking at, again, I see a lot of WhatsApp being mentioned. And I just have to put aside one cautionary tale about WhatsApp. And this is something that you need to know. WhatsApp is only encrypted as long as you don't back up your data. And this is something that I need to everybody who's using WhatsApp needs to know this. It's really important to understand this. And I'm not an expert. I'm not saying, look, this therefore means this legally, but this is something that you need to be aware of, that WhatsApp is secure. Like, so for example, if I was to send Kev a WhatsApp and say, hey, what's up? This is a photo. What do you think? As long as I don't back up my data and he doesn't back up his data, WhatsApp is secure. But the moment either he or I uses an auto backup, that chat is no longer secure. It can be, it is cloud available. Yeah. And actually that's been one of, again, 12 months ago, I was all, WhatsApp will change the future. It's secure, it's encrypted. And then we have these little things that come to light as you have these committees. So personally, I can only say this, that, while I hate the process, While I hate the red tape, while I hate the bureaucracy of having to wait for a set of lawyers to actually verify software, I believe that it should be led by associations and societies that actually invest in a team that will do this so that they can go through this.
So Sharat, another thing maybe I can add to a question that's come in, does the HSE have access to the software for teledentistry? I would love, there are many people here who work in the HSE, maybe you guys can share in the chat there and advise us if the HSE has taken this on board anywhere. And once again, like you were saying, Sharat, if once one part of the HSE has this, maybe that's important stuff to share as well. So we're getting stuff in from Cork, from the HSE down in Cork, where Danny is saying that they're using T-Pro, which is great. And Alison's then reporting that there's a couple of programs in as well. And it'd be great, again, if any of you guys are using this, please come on and share your experience with us. I think it'd be really valuable for us to hear how you're getting on with this.
And I think somebody asked me to repeat the message regarding diagnosis. I use it only as an emergency thing that, you know, if a parent is so it's like this, if a parent wants me to say, oh my God, should I be worried about it? And they send me a photograph, listen, do you think you're worried? If there is anything that says in my head that come in, please come in. You know, so in the sense, the only way that you can use diagnosis is more of a reassurance of what you already know. But in terms of making a fresh diagnosis, so again, let's separate the two. This is really important that at least for me, to separate the two. There is dentist to dentist diagnosis, the teleconsultation part, and that is safe, that is secure, that's as good as it's going to get. I mean, right now with the whole thing, that's as good as it's going to get. The other part, the direct diagnosis, it's tempting. It's very tempting. I won't lie. I think I sent Kev a poll. I said, have you ever texted a patient? I think that was one of the questions I asked. I said, have you ever texted a patient? I'm not going to say anything which is being recorded, but we all know the answer to that one, even though we don't want to record it. But I would say, I think Alison's got a good point on that. She says it aids in triage. Yes, it does. It also aids in preparing yourself to receive your patient. I think that's the key. That, you know, whether it's organizing your resources, whether it's organizing what you would like to set up for that patient, whether it's also like, you know, I don't know how it works in Ireland, but here in Canada, you do have places where you got to send out like certain supplies to a remote practice. So I think that's where the power of teledentistry lies. I mean, if you ask me where the future of teledentistry is, 2 years ago, I'd have said, oh yeah, you know, to telediagnosis, whatever. I think that part is already being done to what it can be done today. I think the future of teledentistry really lies in streamlining our logistics, streamlining our consultant hours, because, you know, consultants are overworked. If you want everybody to come in to see a consultant, they're either overworked or underutilized, and sometimes both, or depending on the day it is. And I think teledentistry really helps people, you know, address that, and that's where I would see it. So I don't know if I answered the question or if I went round and round trying not to answer it, but
I can't remember, but it was very interesting. I think something that comes to mind as well that maybe we haven't discussed, and probably it's going to grow in the future. Another benefit that's often cited is it's good for the climate change, reducing the amount of travel that's necessary. And I think when we start looking at things more closely from a sustainability perspective, things like desensitization visits, getting to know the clinic, the staff and all, these are going to start clocking up heavy in carbon footprint. So I think these are great positives for that to maintain access for our patients in the future as well.
I think it's a great point. I really, really do. And I just wanted to also add, you know, cost. It reduces cost. Like, you know, I always tell people, you know, yeah, you know, the appointment cost is this much, but, you know, we charge parking in our parking lot and it's pretty expensive. And you're absolutely right. You know, things like a desensitization visit. I mean, this is where, you know, it depends on how innovative you want to get with it. So we have a couple of students who are trying to do this. You put on a little camera on your head. the little GoPro thing, and you can actually go through the clinic walkthrough, and you take the patient on a virtual walkthrough.
Yeah.
And we're trying it. I mean, it's great fun right now. It is great fun. Alison says patients love it. I think so. I mean, I would love it too. And there's a lot of research to evidence this, absolutely. And I'm just curious why we're not having more people come on. I think I'm hogging the conversation here, Kev. I think I should I think there's some great points coming out of there. I mean, it is true. There is a lot of new research coming in, which is why I actually referenced the journal. I said, please, if I'm sure your universities have access to it. I mean, and they do have a lot of good open access stuff, but there is a lot of stuff that's come out since the pandemic came out. And both sides of the coin. I mean, I don't want to glorify teledentistry and say it's the answer to all problems. At the same time, I do not want to say that, be scared of this. But I think it's finding that middle path, it's finding that middle path. Teledentistry is here to stay. I don't think anybody in this audience or anywhere today after 6 months or 8 months or 10 months of pandemic care will disagree with teledentistry. But I think the challenge for us now is to find that middle path.
So when you, if I can paraphrase what your main message that seems to be coming out to me here is that one of the areas that you're most hopeful for teledentistry is that network between the primary care dentist and the dentists who support them, and then the consultants as well, and really breaking barriers down in that network.
Yes.
And I just wonder, when I think about the groups of people who are online now, we have people at all different steps in that network. And I just throw out the idea that if people are willing to explore that, maybe we can share this through the ISDH, through Facebook and ISDH, and we can start building up a conversation that hopefully might lead to actual development of new services or new service models. And I'd love to hear what people think about that. Are people willing to engage in that?
There's a little class, a chat about multidisciplinary working, and I'm not sure if Alison would like to speak about it. The only thing that I want to actually bring up is also cost. So I know that in Canada it's a little different from Ireland. I'm not sure if Ireland is working on a pure government model, but what I would like to actually talk about is in reducing the cost to patient, either in time of how long it takes for them to get a consult, also in terms of how long it takes for doctor-dentist telemedicine. So, like, for example, this is something that's not really been explored too much, but it has definite potential. What is the level of link? And it's a question of how much would you like to get your patient involved with the physician, and how much you would like to get involved with your patient's physician. Because here in Canada, it's a 3-month, 6-month waiting list to get certain things. On the other hand, if you are able to get an immediate appointment, you could cut that time. And I believe that a lot of it is doable with that. So I will let Alison speak.
Yeah. I think there's a point there coming from Catherine Waldron there as well about the role of hygiene and prevention in this as well. Hey, Alison, thanks for coming online. Hey,
okay, thank you. It's a surprise. Hi, Sharat.
Lovely. How are you, Alison?
Well, Alison, I was just, as I was waiting for you to come in there, I just mentioned Catherine Waldron's point there about prevention and teledentistry and the benefits that has. And I know we've been working with Svetlana in the dental hospitals who can actually get into people's bathrooms, the environment and the toothbrushes, and see the issues that are going on at home in a way that we've never been able to before.
Yeah. I think that's a very good point. I think that dentistry in a way is disadvantaged with medicine because of its pay, the way it's paid. But I work within hospitals and medical teams, and I've seen medical teams really embracing this. And I think the psychology and physiotherapy have really embraced it. And I'm thinking about the behavioral interventions that we've always wanted to do, whether it be smoking cessation, whether it be motivational interviewing properly with all of the follow-up and all the cognitive behavioral approaches I think that all the disadvantages of those can be overcome, and a very, very, I think this is a very good model to be able to really embrace behavioural interventions, because often there's not room to do it, there's not the space, there's not the quiet place, it's not the right time for the patient or the clinician. So I think that I've seen my colleagues, and in fact we published from our multidisciplinary team, and physio and psychology are the big winners here. I want to talk about my big advantage for our groups of people in special care dentistry, because I think interdisciplinary and multidisciplinary working is so important for us. And I found that we can have huddles with the whole team remotely using teledentistry. So you can have the case conferences, or you can have the consent stuff, for example, or you can have a multidisciplinary meeting. And I think this has been enforced by COVID because we can't sit in the room together. So instead of doing a huddle at the beginning or doing a consult, we've had to do it using the telemedicine platforms. And everybody who's been involved in this has said, why haven't we done this before? And this will definitely carry on. So I think people are busy, they can't travel to meetings realistically. It's almost impossible to get a multidisciplinary meeting if you're not in the same unit. And I think this opens up huge potential for us. And then the only other thing I wanted to say is I hate, and always have done, patients seeing my number, being able to contact me. And so I find that the big advantage for using a proper platform, and I hate phoning patients, rarely do it, is that they don't have my telephone number. They haven't got my Zoom contact. So it's all done, and that's cultural. I know in the Middle East, for example, it would be normal. In Turkey, it would be normal. But for me, as a Brit, or even I don't like, and I forget to mute or hide my telephone number. And then in Ireland, people won't pick up unless they can see where the number's coming from. So I think using a proper forum allows you to have a good, meaningful, planned conversation at a time, like without sharing your telephone number. My patients won't pick up if I don't share my telephone number, and I don't want to share my telephone number. So I think that's the big advantage for having a proper.
I find that more people answer my calls when I don't show my number. It's amazing. Alison, can I ask you, since we have you on, for the people who want to get started in this, what are the bits of software they need now?
Well, I agree with Sharat. I think regarding across medicine, Ireland has led the way. And dentistry has variably approached it. And so I think the advantage we have here is exactly as Sharat said, very quickly programs and legislation was put in place. And the HSE has adopted, I think it's 3 programs now, and through hospitals or through, you can get really good deals. And so those prices are the prices, but through work, and so the HSE is using this, it just hasn't necessarily been looked at. So I think getting your platform right, getting a piece of kit, it's like you can't start to do rotary endo if you haven't got your micromotor, whatever. There is always a setup cost. And then the other thing that you've got to do, I think, is to think about a teledentistry consult as an appointment. So set a diary of appointments. In fact, the good programs set a diary for you, give you a reminder, all those things. So I think it's not see it as an add-on, but actually schedule it. That's what the medics do. They have telephone video consult clinics. And actually what it's shown during the pandemic is those people who embraced teledentistry and did remote consults have been able to show their employers their patient consults actually increased during COVID. So I think we can make business cases for efficiency. So we've got to bring patients for less time face to face. We do their medical histories, their goals, their backgrounds, their fact finding. Without bums on seats, we can be more efficient. So a business case, a case for the planet and sustainability. That's trendy in hospitals and clinics at the moment. as it should be, but there's money for sustainable options. There's money for sustainability. So I think that's an argument as well as business. And then the thing that always is good, patients love it. Patients want it. Patients value it. So I think all of those things are the argument to start using it, and then be creative in how you can use it. So you need the kit. Don't start it half-heartedly. You need the kit. You need to have proper time and value it, and don't downplay it. So find things in the way you're going to be able to use it. We do all of our post-operative reviews with teledentistry in a proper review clinic. We do most now of our assessments via teledentistry before the patient comes in. So we've done the medical history, the goals, the complaint, so that when a patient comes into the practice, you're ready to go. That's efficient. And we've involved the whole team. So our nursing and hygiene team will do a lot of the prep work. So all those things, but you've got to have the kit. You've got to have an open mind, and you've got to be realistic what you can use it for. But the multidisciplinary meetings for me are really good for special care dentistry. I hope that's not too much. Yeah.
And Alison, can I bring you back there to, as you describe your team starting it and taking this seriously and formalizing the process, know that your team and yourself and Laura have indeed, you've measured this.
We have.
You've actually measured it, researched it, and shared that, leading the way again, like Sharat was saying. And this brings you back to Sharat's slide about numbers matter. And I think I just want to probably re-emphasize your words there, Sharat, that as we do start this, I think we all need to create our own evidence for this working locally and working safely.
And if I may just, say one last thing too, there's two types of evidence. There's the scientific evidence and there's the monetary evidence. And I think and I know people laugh at me when I say this, but it is so true, because if you are going to have academic credibility, you need your papers, you need the research, you need the scientific model behind it. And I think with teledentistry, we've reached that part. So if anybody here is looking to do research, it isn't new anymore. People have used it. It works. We know it works. But I think there's another part of research, which is basically market research, hospital cost efficacy. They do call them cost benefit ratios, those kind of analyses. And I really believe that that kind of data, when that starts coming in, once people start processing it, that has a far quicker impact than actual scientific data. Because what that does do is that says to hospital administrators as well as policymakers, okay, this is worth putting so much in. You can get a so many euro return for a €1 investment. If you and I personally, I'm just going with gut feeling on this, but you would definitely get more than a 1-to-1 return on whatever you spend. Because
I wholeheartedly agree with what you're saying. I think in patient costs as well, your point, I think someone's just made a point about no one being left behind. I think number one, we have to realize that Ireland has the highest per capita spend on mobile phones. We're really into our mobile dentistry here, and I think we can't make assumptions. Older people, because of COVID now, have upgraded to smartphones so they can Zoom their children. The thing is, older people have embraced technology. And I'll take an example. Today, I saw an elderly gentleman. He was 78 years age. He had a severe bleeding disorder. He lived in Monaghan. Before he came, his daughter helped him take a photo of his teeth. So I could tell whether he needed to just go and have a temporary filling locally, or whether he needed to come all the way to Dublin. When we had the photograph of his tooth and we chatted with him through his pain history slowly, and giving him time to think about it, explained everything that was going to happen. He came today, we were fully prepared. We knew how he would be. He was very vulnerable. We needed to bring him in to the hospital very carefully, shield him and get him home. So we're able to do all of that and bring, with an older guy instead of 2 visits. That's how I think not to leave people behind by cutting down their time, their visits, and not making assumptions that people with disabilities don't have access to technology. Their carers will help them with computers or with phones. So I think we mustn't make assumptions about that. And I think cutting down visits for carers and cutting down visits for older people or people with mobilities is one of the big things we can do. Cut down unnecessary visits. That's really cutting carer burden. So yes, we can't do so much, and we can't arrange for everybody to socioeconomically have all these facilities, but we can really cut down the burden that we place on them by doing as much as we can. That's my view on how not to leave people behind. Yeah.
You know, we're looking, myself and yourself, Alison, we're involved in a group that are looking at the impact of COVID on special care dentistry.
Yeah.
And almost all of the measures that we have are in negative. You know, COVID has led to a decline in access to GA, a decline in access to dentistry. And there's one stark area of optimism, and it's teledentistry. Teledentistry is a success story that's coming out of COVID. And it's amazing. It's amazing. It has the long-term impact potential is great. So look, Sharat, I'd like to thank you so much for coming on and giving us your time. It's been fantastic to hear your expertise in this. So
thank you. Thank you very much. It's always a pleasure to be here. Take care.
And Alison, thank you very much for joining the conversation. I really appreciate your expertise.
Pleasure. Okay, I've enjoyed it. It's a subject that's very dear to my heart, and I always love hearing Sharat.
Thanks, Alison.
Even when I was making, I was trying to put the polls up earlier on, they weren't going up, but you handled it like a pro. That was just okay.
He runs our webinars for the IADH, so he is a pro.
Thank you.
Okay, so to our audience, I'd like to thank you all for coming and joining. Please make sure and tune in for our next webinar, which is going to be on resilience on mental health for dentists and dental care professionals in special care dentistry, which will be run in next month. So if you are not already on our Facebook page, please join. And if you're not a member, the ISCH is a great organization, and your membership counts. It lets us do awesome things like this and promotes the oral health of people with disabilities in Ireland and around the world. So, leis sin, íomhá chairde agus togi go bugé. Slán.